Hey guys, welcome and welcome back to another video. So guys, today let us talk about, or let us look at some of the myths and misconceptions about female genital mutilation or FGM. So female genital mutilation, sometimes called female circumcision or female genital cutting, is a global problem and controversial issue. Yet there are a lot of misconceptions or there are a lot of myths that must be addressed or should be addressed. So some of these myths, I'm going to highlight them and explain them in details. So number one myth is that female genital mutilation or FGM is one of the standard procedure. It is not true. World Health Organization does not recommend female genital mutilation unless let's say that World Health Organization define female genital mutilation as any procedure that involve cutting, partial or a complete cutting or removal of the external genitalia of a female, or any injury to the female organ. Yeah, and it is a non-medical procedure. I've already talked about this female genital mutilation in one of the videos, so you can go and revise it. I'm not going to go into it in details. So about 200 women, about 200 million women or girls and women alive today live with this female genital mutilation, and therefore most of the people who deal with the female genital mutilation or experience it. So I was saying most people who are affected with this female genital mutilation, or most of the people who experience female genital mutilation, are Africans, especially Egypt, Ethiopia, Indonesia, Eritrea. Yeah, those African countries are are the people who experience this female genital mutilation. Under this female genital mutilation, it has four types. Yeah, it has four types, which involve clitoridectomy. This is partial or complete removal of the clitoris. We have excision. It is any cut and it involves removal of the clitoris and the labias. And also we have infibulation. It is the creation of a seal to narrow the vaginal opening by cutting and stitching the labia. Yeah. Infibulation may or may not include clitoridectomy. And we have the another one which involve all these types. The type 4 involve all these types. It involves clitoridectomy, incision, and infibulation. So female genital mutilation is not a standard procedure, and the World Health Organization does not recommend it. Number two, the second myth is only teenagers undergoes surgery as a rite of passage, which is not true. Women from 15 years, not even 15, women from 12 years all the way to 45 and above experience female genital mutilation. So it is not true to say that, or it is not true to be told that only teenagers undergoes or the people who goes or pass this rite of passage. They usually call it rite of passage. So it is not true to say that. Yeah, because from the age of 12 all the way to 45 years, these women usually experience female genital mutilation. Also, the third myth is girls understand and choose to undergo the procedure, which is not true. Most of these communities, or most of the countries where this female genital mutilation is being practiced, girls and women are being forced to undergo the procedure, and the procedure is painful. The procedure is non-medical, so they don't choose to do it. They are being forced, which means that sometimes they are being told that it is a must they go through of it so that they can pass through the rite of passage. Yeah. Number four, the fourth myth, or number four, is that it is not that common, at least not anymore. It is not okay. I'm trying to say that some people usually say that it is not common, which is not true. It is common in most of the African countries, especially Somalia, Egypt, and even in Kenya. It is common in those countries. Yeah. Number five is that the procedure is performed by medical practitioners. It is not true. The procedure is not being performed in all these countries. The procedure is not being performed by medical team or in any of the hospital or by medical practitioners, because the World Health Organization does not recommend this procedure at all. And most of the country or most of the community who usually practice this female genital mutilation, they do it under the water. They don't want to be noticed. So they are, most of this community, they have some people in the villages where they go and hide there and they perform this procedure. The procedure is painful and it is done just locally without any medical consideration, or so it is not recommended. Therefore, it cannot be performed by medical practitioner. So that is something that you should not be told. Myth number 6 is that if the surgery is performed correctly, there are no long-term complications, which is not true. Remember, we have said that female genital mutilation, we have 4 types: the cleridectomy, the excision, and the infibulation. And also we have the one that involve the 3 of them. So this surgery, or whatever they call it, I don't know if it is surgery, but it is not surgery. It is just a procedure that is being performed by people who are not even experienced, people who are just have what, I don't know. They just don't reason, because those things are no longer there. If your community is still practicing female genital mutilation, it is wrong. It is putting our girls under the risk of so many complications. So, which is those communities usually tell girls that it doesn't have long-term complications. It has so many long-term complications. Like, sometimes you will experience pain during sex, you will not be able to give birth, you can sometimes even have infection. It has a lot of long-term complications. So it is not true to say that. So let you not be cheated that it doesn't have any long-term complication. Number 7, it is possible to perform the procedure so that it does not harm girls. It is possible to perform the procedure so it doesn't harm girls. It causes a lot of harm. It causes a lot of bleeding. It is painful. It has acute pain and chronic pain. It has so many long-term complications whereby it can cause obstructed labor. The woman can give birth and dies. The woman will never enjoy sex. It can cause infection in the female in the reproductive system. It has a lot of complications. So the procedure, it is not possible. It is that statement is not right. Number 9, it does not. It is done for health reason. Which health reason? It is not done for health reason. Most of these people who perform female genital mutilation, they do it for the purpose of cultural practice. Some of these supporters of FGM claim the practice has health benefit, which is not true. However, let's say that these beliefs largely stem from the idea that female genitals are dirty, maybe, therefore girls need to be cut off. So it doesn't have any health benefits or health reason that they usually instill in your mind about it. So it is wrong to say that it has medical reason, that is why they usually perform it. It doesn't have. Number 10, it only happens in developing countries. Female genital mutilation is a global problem. Yeah, it is a global problem. Even some people in the West, usually, some men usually, I know it is common in African countries, but it is a global problem because some of the communities in even US is a developed country. There's some women or some communities usually practice those, female genital mutilation. Also, number 11 is it is comparable to male circumcision. It is not comparable to male. It is not comparable. Number 11 is that it is comparable to male circumcision, which is not true. It is not comparable to male circumcision because male circumcision has a lot of health benefits, from hygiene to prevention of STI to prevention of HIV or sexually transmitted infection. But with the female genital mutilation, it has a lot of medical complications, not health benefits. The last one is number 12, where we say that, or they usually say that women who have undergone female genital mutilation cannot experience sexual pleasure. Women who have undergone, in simple terms, if you have a female genital mutilation, or if you've done female genital mutilation, you will not experience sexual pleasure. So, female genital mutilation usually interfere with your external genitalia, which is the clitoris, because type 4 and the first one that I said is clitoridectomy. It involved removal of the clitoris, and if you went for, or if they did that, the clitoridectomy and the type 4, which complies, or which has the 4 types, you will not experience a sexual pleasure. But I think those who have undergone, women who have undergone the excision and the infibulation, they usually experience sexual pleasure. So it depends with which type of female genital mutilation or FGM that you have undergone. Yeah. So if you had clitoridectomy, you will not experience female sexual pleasure. But if you had infibulation, and you might experience. But female genital mutilation, it usually tamper with the external organ, and that female external organ play a role in sexual activities. So this idea that they say, if you have you have a female genital mutilation, or if you have FGM, you will experience a lot of excitement during sex. It is not true. Because if you have female genital mutilation, reaching the orgasm, you will never reach the. Okay, I was saying that if you have female genital mutilation, it is rare for you to experience orgasm if you are a woman. compared to someone who doesn't have female genital mutilation. So guys, I'm going to stop from there. Let's meet in the next video. Till next time, bye.